Hi, Tom. Thanks for joining me.
Hi, Andy. Thank you. Nice to meet you.
Can we start? Could you introduce yourself first and foremost, please?
Yeah, so I'm Tom Norfolk. I'm a general dental practitioner and I'm chair of the local dental network in East Anglia, which covers Suffolk, of course, and I'm also a dental advisor with NHS England.
Thank you. And thank you for agreeing to do this interview. I've got 4 questions for you, and I'll move straight into the first one, which is one I ask everyone. How are you looking after yourself and how are you supporting your team?
I think the team approach has been helped by the virtual reality, the virtual screens, the Zoom, the GoTo, the Teams meetings, which has made communication better. And so we've concentrated on communication, not only with colleagues remotely, but also within the practice. So dentistry is shut down to start off with. So we're all on Zoom and Skype and trying to figure out what we're going to do, how we're going to look after our patients. And then after that, we started to develop more face-to-face work as we started to open up the practice to emergency patients initially on a very, very sort of strict criteria, but the team needed to be in the practice. So distancing of 2 meters, masks on, trying to figure out how we're going to work it. So it's been all about communication for us, lots and lots of it, and hopefully seeing each other over the screen. And myself, just trying to sort of keep up with friends, family. It tends to be very much family orientated. So it's been quite nice to actually have that ability to sort of see a little bit more of the family. But I've missed my work colleagues.
I get that. Yeah, no, I completely get that. We talk about the advantages of online communication, but we do miss the face-to-face, and that's the first thing we're planning. Thank you. So my second question is this. When will dentistry get back to normal, whatever that might look like?
Yeah, and that's a good question, whatever it might look like. I think we're going to struggle to go back to normal for a long time. And I think normal will look different to what it looked like before because of the PPE, because of the distancing, and because of the fact that dentistry is related to the airway. And so we're working so close to the patient's mouth and we're generating aerosols. And aerosols are basically when we get a drill out or anything that squirts water under high pressure, it creates lots of water droplets in the air. And viruses, the coronavirus, loves to live on those water droplets. And that gets into the room. And so we're waiting for guidance on how we deal with that in the most effective manner. At the moment, we're allowing lots of time for those droplets to fall to the ground, cleaning the surgery and then going back in again. And that changes the situation from a turnaround of 10, 15 minutes in surgeries for patients on a sort of short appointment to sort of an hour and a half, 2 hours. So it means the patients has reduced dramatically. It also means the checks we have to do with patients beforehand to try and establish if they've got symptoms. And it also there's limitations on what we can do. So when people turn up, there's a lot of preparation required now. So we can't just actually get on and do a procedure. We need to actually prepare for it. So sometimes we have to get people back once or twice to actually do something that would have taken us a short amount of time. So patients are going to have to be mindful that they won't just get things as quickly and easily as they did. And I think that's here to stay for a long time, certainly winter. I don't see it changing this side of Christmas, and it wouldn't surprise me into next year if we're still having trouble actually getting anything back to a normal level of regular checkups and that sort of thing. So normal feels very different. We're prioritizing urgent courses of treatment, so those people who are in pain, those people with swelling, those people who are struggling to cope with problems in their mouth or have got concerns about things. They're the main priority. And then as we go through the transition over summer into autumn, we'll try and get in touch with patients who are perhaps more vulnerable with regards to their oral health or a higher risk, but bearing in mind the fact that everything is working so much slower. So getting dentistry going is proving incredibly difficult because of the aerosols we generate.
What about safety on the part of the workforce?
Yeah, and that revolves around these aerosols. So we've got a lot of PPE requirements now. So PPE has changed from being relatively the same for decades, really. A mask, gloves, something to cover your eyes, perhaps, that sort of thing. It's now changed to very sort of high filter masks, they're called FFP3s or FFP2s, which are just, there's a designator of how much of the virus they filter out of the air. Gowns, a bit like you'd see in a theatre setting, and big visors, and changing it all incredibly frequently. And that's for when we generate these aerosols. When we don't generate an aerosol, we can go back to normal PPE. That's not a problem. The cleaning down takes longer, but the normal PPE. But as soon as we start these aerosols, and anyone who's been to the dentist will know these aerosols are all over the place. A Wheezy drill, a scaler, anything like that, which we use day in, day out repeatedly, suddenly creates a big problem for the team. And so we have to be very careful with ensuring the team are distanced. The viral load is kept to a reasonable level, so someone's not doing AGPs day in, day out, because we know that viral load makes a big difference to survival rates if you get coronavirus. And initially, a lot of dentists got COVID because we didn't understand the problem, and I don't think we still quite understand it yet. There's a lot of research going into it with regards to the airway and aerosols.
Thank you, Tom. My third question is this: how can patients do the best to look after their mouths, and where can they easily turn to for guidance?
Looking after your mouth from a dental point of view hasn't changed. It's prevention. It's avoiding sugar, keeping the number of frequency of sugar attacks down to a minimum. And sugars in sweets, in chocolate, in processed foods, in fizzy drinks, that sort of thing. So keeping the number of attacks your teeth get with regards to sugar, and of course it's oral hygiene. It's brushing your teeth well. If you can afford or have access to electric toothbrushes, then electric toothbrush. If not, a good manual toothbrush. Change the head frequently. Use a fluoridated toothpaste, and most main manufacturers are producing fluoridated toothpaste now. Brush your teeth well for 2 minutes. Don't rinse the toothpaste off, what we call spit, don't rinse. So spit the excess out, but don't wash the toothpaste off your teeth, because toothpaste is good for your teeth. Brush them 2 minutes in the morning, 2 minutes at night. Flossing's great, certainly as an adult, if you can manage it, or cleaning in between your teeth with interdental brushes, that sort of thing. So the combination of actually looking after yourself is now incredibly important, because if something goes wrong, you can't just suddenly nip down to the dentist and get an appointment, get it fixed there and then. You're going to have to wait. The concept of waiting lists will probably come to general dental practice, high street dentistry, if it hasn't already. So prevention is the key. And as far as sort of getting sort of guidance, there's lots of websites. I know yourself, you have information on your website. And there's a variety of oral health websites out there. If you're associated with the practice, they may have some sort of guidance as well. So there's lots of information there. The British Dental Association, which you can Google very easily, has got lots of oral health guidance as well. So there's a fair amount out there to sort of support people in pain relief if they're struggling with pain, and how to get access to a dentist at these particular times. And that is, phone up the nearest practice to you. If you've got an NHS contract, they're able to see anybody who approaches them. If they've got capacity and you phone them up, then hopefully they'll be able to help you, certainly with the initial emergency or urgent appointment. And so they're there. You can Google them. You can go onto the NHS 111 choices site. It's there. You can phone 111 if you're desperate as well, but first of all, try and do it yourself if you've got access to the internet. And the NHS Choices site will give you a list of the dental practices, and there's a specific sort of question you can ask: where's my nearest dental practice? And put in your postcode, and it'll direct you to the nearest ones. So that's the best way people are going to get access at the moment if you haven't got a regular dentist. And if you have, approach them first and find out in what state of readiness they are to be able to see patients, and that will depend on their PPE, how many patients they've got, how well their staff are, all that sort of thing.
there's a lot to consider, though, isn't there? We've had, as a Health Watch, a spike in phone calls and emails and feedback about dentistry over the last 4 or 5 months, and I imagine you have as well as dental practitioners. Is another option for people the high street pharmacist, the community pharmacist? Yeah,
they approach the pharmacist. We link well with pharmacists. They've been helping us out with remote prescribing during the lockdown when we couldn't see patients. So we're prescribing antibiotics and painkillers remotely to the pharmacists. And so yes, they may have temporary filling kits they can help with if you've got a sharp tooth or something that's broken, and so you can get in with your dentist. They'll be able to advise you on painkillers, and if you take a list, if you're taking any medications, take the list along so they know what you're taking if it's not your regular pharmacist, and they'll be able to give you some guidance about where the nearest dentists are and that sort of thing. So that's a good source of knowledge as well. Yes, you're quite right.
Thank you, Tom. The last question is this, and it's about looking into the future. What learning and challenges do you think will come from this outbreak?
I suppose the learning is that we don't need to travel everywhere. We don't need to get in the car and visit everybody. It can be over the screen, and I think that's going to be, from our point of view, great learning, and that includes linking with patients. You know, when it's not easy to see a patient, when they're at risk, they're vulnerable because of their medical condition, we can have a discussion, see them face to face, and to find out what the problem is, and try and do our best to ensure we get them to the right clinician first time, rather than going through various different stages. So from a clinical point of view, technology has really jumped forwards, and we want to use that and learn from that. I think the challenges for us are seeing the patients, getting through the volume of patients, the numbers of patients, in a world where we're probably only going to be able to see, certainly at the moment, 10-20% of our normal throughput of patients. You know, how do we choose those? Who do we see? How do we prioritize them until we can sort out this virus, until we can work out a way of safely working with it? So those would be the learning points and challenges.
Thank you, Tom. Thank you so much for all your thoughts on this subject. I really appreciate it.
Thanks. Thank you. Thanks, Andy.